So in continuation of our return demonstration on parenteral medication administration, so the equipments that we need to use are the sterile syringe, needles, ampules or vials. So we don't have available vials. Ampule. We only have the vial, and then the sterile gauze swab, or you can also use sterile towel. Pickup forceps. So we don't have a pickup forceps, but it's very important to have one. Since we're just doing the return demonstration at home, we don't have any available pickup forceps because we don't have the SHN bag yet. Or the what do you call it? We don't have the equipments for the hospital duties. And also cotton balls, 70% isopropyl alcohol, and the injection tray. So it's very important to have the injection tray so that you'll be able to put everything like in one place, so that it won't scatter like anywhere. So everything should be organized. So for the syringes, it has three basic parts. So this is the syringe. So the tip, the barrel, and the plunger. Then the most common use types are hypodermic syringe, insulin syringe, and the tuberculin syringe. Now for the hypodermic syringe, it comes in 2 to 2.5 to 3 and 5 ml sizes. So let me just show you. So this is the hypodermic syringe. So as you can see, it's up until 5 ml in size. The insulin syringe is similar to hypodermic syringe, but the scale is specially designed for insulin. So as you know, people with diabetes uses the insulin syringe because it is designed for the insulin administration for diabetic patients. Now third is the tuberculin syringe. So it is a narrow syringe calibrated in tenths and hundreds of a milliliter up to 1 ml. So on a scale, and in sixteenths of a minimum up to 1 minim on the other scale. So for the, yes, we don't have any available tuberculin syringe. So we only have the hypodermic. For the needles are made of stainless steel, and most are disposable. So this one. So next, now needles have three parts which are the hub first onto the syringe, the cannula or the shafts, and the bevel. Now, how do we prevent needle stick injuries? So needle stick injuries present a major risk of infection, so you have to be really careful in order for you not to transmit any diseases or infection to yourself or to someone else or to other person. So it is to prevent the transmission of hepatitis B virus, HIV, and many other pathogens. So one is to use appropriate puncture-proof disposal containers to dispose uncapped needles and sharps. So never throw sharps in waste baskets. And use appropriate puncture-proof disposal containers to dispose of uncapped needles and sharps. Never bend or break needles before disposal. Never recap used needles except under specified circumstances. So, when recapping a needle, use a safety mechanical device that firmly grips the needle cap and holds it in a place until it is ready to recap. Now, we use the one-handed scoop method. Now, ampules and vials. So this one. So these are frequently used to package sterile parenteral medications. Now, ampule is a glass container usually designed to hold a single dose of a drug. It is made of clear glass and distinctive shape with a constricted neck. Now, a vial is a small glass bottle with a sealed rubber. So this is a vial. A rubber cap. Now, several drugs are dispensed as powder in vials. A liquid diluent must be added to a powdered medication before it can be injected. Now, the technique of adding a diluent to a powdered drug to prepare it for administration is called reconstitution. Now, how do you prepare medication from ampules? So you have to plan first. You have to prepare the medications from ampules and vials, which involves knowledge and use of sterile techniques. Now, what are the equipment? So the equipments are ampule of sterile medication, vial, antiseptic swabs, syringe, needle for administering the medication, filter needles for withdrawing the medication from the ampule, medication sheet. Now, for implementation, preparation, you have to check the medication sheet first from the patient's chart. Then check the label on the ampule carefully against the medication sheet to make sure that the correct medication is given and being prepared correctly. Now, follow the 3 checks for administering medication. Read the label on the medication. So number 1, when it is taken from medication cart. Number 2, you have to check before withdrawing the medication. Number 3 is after withdrawing the medication. You have to organize the equipment. So procedure. Now, first is you have to perform the hand hygiene and observe other appropriate infection control procedure. Now, the rationale for this is to prevent the spread of microorganisms and germs. Now, second is flick, because there's no ampule, so we'll just pretend that this is the ampule. Now, flick the upper stem of the ampule several times with a fingernail. So, flicking like this one. So, ampules have smaller necks compared to the vials. Vials have thicker necks and they have flat surface, but the ampules, they look like this one. The tips is very similar to this one. Thin tips, thin elongated tips, and they're smaller than the vial. So it is to dislodge the fluid that collects the upper neck of the ampule. Now, all solution moves into the lower part. So that is why you have to flick the upper part or the neck of the ampule in order to remove the solution that is stuck on the neck part of the ampule. So third is place a piece of sterile gauze between your thumb and on the ampule neck. So for the sterile gauze, so let's just pretend that this is a sterile gauze. So this is this one. So place a piece of sterile gauze between your thumb and the ampule neck. So this one. Now, placing the pad around the neck of the ampule protects the nurse's fingers from trauma, as glass tip broken off. So we have to break the glass, and the reason why we put this here is to prevent our hands from getting hurt, or from um, or from the glass of the ampule. Now you have to break off the top by bending it towards you, so towards you, to ensure the ampule is broken away from yourself and away from others. So it has to be towards you, that way, not that way, because if you will do this way, then the glass um, will scatter like around you or on your face. It is to protect the nurse's fingers and face from the shattering glass. So that's why you don't do it this way, but you have to do it this way, not that way. Then dispose the top of the ampule in the sharps container. The rationale is to prevent accidents and injuries. Now you have to place the ampule on a flat surface. Now the reason why you have to place the ampule on the flat surface is to prevent it from to prevent the ampule from being like tripped off, or like accidentally what do you call it? Accidentally what do you call it again? Like trip, right? Trip off, like the ampule, like to prevent accident, or to prevent the ampule from or for you not to be able to drop the ampule from the ground. So that's why it has to be on the flat surface. Let's just use that word. And then or tripping off, and remove the cap from the filter needle. So you have to remove the, so this is the filter needle, so remove the cap from the filter needle. Just be careful when you are removing the cap. Then insert the needle into the center of the ampule. So it has to be at the center, but because we're using a vial, so it's going to be a different story. So you have to insert it in the middle of the rubber. So carefully place. So that one. Now, the rationale for this is when ampule is inverted, solution does dribble out of the needle tip or shaft touches the rim of the ampule. And then withdraw the amount of drug required for the dosage. So it has to be the required amount, so that so for this one, see, the needle is too far from the medication. Now all you have to do is to slant or tip the bottle a little bit in order for the needle to reach the medication. And then withdraw the exact amount to prevent overdosage. So it has to be the exact amount of what's on the medication sheet. So you have to carefully, you have to hold it like this, not like this, but like this. Now, so we've just withdraw the, let's say 3 ml of medication from the ampule. Then after, you have to dispose of the filter needle by placing it in a sharp container. So you have to correctly do the correct disposal of the needle and the glass to prevent accident and contamination and transmission of infection. So it's to control the transmission of infection. So that's why you have to dispose it in the correct um, bin or disposal. Now replace the filter needle, then tighten the cap at the hub of the needle and push the solution into the needle to the prescribed amount. So new needle prevents medication through skin and subcutaneous tissue. Now, what I showed earlier is actually the preparation of, as well as for the vial, because we don't have available ampule. So I was just explaining earlier on how to do and pretending that this one is a vial. But as you can see earlier, I did the preparation of the vial. So going back, um, vial or the equipment is a vial of sterile medication, a syringe with needle, filter needle, and also sterile water or normal saline. So the implementation is, or the preparation, again, check the medication sheet, check the label of the medication, follow the 3 checks. 1, when it is taken from the medication card and before withdrawing. 3, after withdrawing the medication, and organize the equipment. So again, we have to make sure that we are, before we prepare the medication for the patient, we have to do the proper hand hygiene. So we always have to have like clean hands, fingernails, and next is you have to mix the solution by rotating the vial between the palm of the hand. So this is how you do it when you are mixing the solution with the normal saline or the distilled water. So it's to ensure the proper dispersal of the medication and solution. Now you have to remove the protective cap or clean the rubber cap of the previous open vial with an antiseptic wipe by rubbing into a circular motion. So it is to prevent the contamination of rubber and to seal, then allow alcohol to dry and prevents needle being coated with alcohol and mixing with the medication. Now 4th is to attach the filter needle to draw up the mixed liquid medication from multi-dose vials. Then remove the cap from the needle, then drew up into the syringe. So I did this earlier. I drew like a 3 ml amount of medication from the vial. So air must first be injected into the vial to prevent the buildup of the negative in vial when aspirating the medication. And next, carefully insert the needle into the upright vial through the center of the rubber cap, maintaining the sterility of the needle. So the center of seal is thinner and easier to penetrate, that is originally. Now inject the air into the vial, keeping the bevel of the needle above the surface of the medication. So air must be injected before aspirating. So injecting into vials airspace prevents formation of bubbles and inaccuracy in those. Now withdraw the prescribed medication. So let's just go back. Okay, so withdraw the prescribed amount of medication, either holding the vial down, moving the needle tip that is below the fluid level. So the needle has it has very important to reach the medication in order for you to properly withdraw the right amount, and in order or to prevent the air from entering the syringe, because it can cause bubbles and inaccuracy in the dose. So inverting the vial So you have to withdraw the air. So inverting the vial, ensuring the needle tip is below the fluid level, and gradually withdraw the medication. So positive pressure within the vial fluids into the syringe. That is the rationale. Now, next is I will be giving you information and providing you an information on how to do the intradermal injection. So, intradermal injection. Now, it is the administration of a drug into the dermal layer of the skin just beneath the epidermis, or it is also called as skin test. So the method of administration is frequently used for allergy testing and tuberculosis screening. Common sites of intradermal injection are the inner lower arm, the inner lower arm. This is the common part. And the back beneath the scapulae. So the purpose is to provide medication that the client requires for allergy testing and TB screening. So assessment is first check for the appearance of the injection site. Now, specific drug action and expected response has to be assessed, and also you have to provide client's knowledge and drug action and response. Now, for the planning, the administration of intradermal injection is an invasive technique that involves the application of nursing knowledge and problem solving and sterile techniques. So you have to make sure that you'll do the hand hygiene first before touching any equipment or medication to prevent contamination and to prevent transmission of infection. So for the equipment, the vial or ampule of the correct medication, a sterile tuberculin syringe, and needle. So we have needle here, syringe, alcohol swab, or dry sterile gauze, the medication record or the medication sheet, and you have to wear clean gloves. So we don't have clean gloves. Now for the implementation, you have to prepare or check the medication sheet first. Now the reason for that is for you to know if you are you'll be administering the right medication to the patient, because if it's the wrong one, then you'll be in a big problem. Now check the label of the vial. You have to check it first. Carefully read it against the medication sheet to make sure that the correct medication is being prepared. Now again, you have to follow the 3 checks for administering medication. You have to read the label on the medication when it is taken from the medication cart, before withdrawing the medication and after withdrawing the medication. Always and always. Then organize the equipment. So the procedure, and again, perform the hand hygiene and observe the appropriate infection control procedures. It's to prevent the spread of microorganisms. Now you have to prepare the medication from the vial or ampule for drug withdrawal. It's to prevent the medication error. So introduce yourself and verify the client's identity. Now to prevent error or medication error, and preparing medication ensures that we are providing safety to the patient with the medication administration. So it has to be the right patient. Now explain to the client that the medication will produce a small wheal or bleb, or like tiny, like small bubble when after administering. Now, explaining for it is to increase the patient's knowledge and what to expect after the medication to reduce anxiety. Now, provide privacy to make the patient feel comfortable. Now, you have also to select a site. Now, selecting the correct site allows for accurate reading of the test site at the appropriate time. So, this is the usual, or the common site for skin tests. And then cleanse the skin at the site using the firm circular motion, starting from the center, from the dirty part up until the outer part. So do it like this when you're cleaning, not from the outer canthus to the inner canthus. It has to be from the inner to the outer canthus. Now, it is to prevent pathogens from the skin to enter into the tissue by the needle, and it is also allowing the skin to dry and prevents introducing alcohol into the tissue, which can be irritating and uncomfortable. Now, remove the needle cap while waiting for the antiseptic to dry. So this decreases the risk of accidental needle stick injury. Now, expel any air or bubbles from the syringe. So it is very important to expel any air or bubbles from the syringe. The reason for it is to because when you are applying the skin test to the patient, like for me, it is the most painful procedure amongst the three or the four. So when if there is a bubble, then it will be more painful. Now, then grasp the syringe in your dominant hand. So this is my dominant hand, close to the hub, holding it between the thumb of the forefinger. So this allows the easy handling of the syringe. So like that. So grasp the syringe into your dominant hand, close to the hub, holding it between the thumb. So like this. This allows for the easy handling of the syringe. Now hold the needle almost parallel to the skin surface, with the bevel of the needle up, keeping the bevel side up, and okay, let's just so for example, this is my skin. You have to, as you can see, the tip of the needle. Now, do not insert the tip of the needle this way. It has to be this way. So like that. Then with the non-dominant hand, pull the skin at the side until it is taut. Taut skin provides easy entrance for the needle. Now insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. It's to allow induction of the medication into the dermis. Now don't put everything inside the patient's skin. Only enough to place the bevel into through the dermis. So don't place everything because we're not doing IM or subcutaneous or intramuscular. Then stabilize the syringe and needle. Now inject the medication carefully, slowly, so that it produces a small wheal on the skin. The presence of the wheal or bleb indicates that the medication is in the dermis. So like a bump, a small bump has to be present. on this part here. And then withdraw the needle quickly at the same angle at which it was inserted. Now, withdrawing the same angle as insertion minimizes discomfort to the patient and damage to the tissue. Do not massage the area, just let it be. And also, you have to use a pen, like a blue pen, a blue or black pen, and then don't forget to write the time of the administration so that it will be easier for you to monitor if the patient on that area of his arm would swell or would react from the medication, so that you have the right timing. So next is administering a subcutaneous injection. Now, what is subcutaneous injection? So SC injections place the medication into the subcutaneous tissue between the dermis and the muscle. So it is in the middle. Now, the purpose for this is to provide a medication that the client requires, and it is also to allow a slower absorption of a medication compared with either the intramuscular or intravenous. So for the assessment, it's for allergies. You also have to assess the allergies to the medication, specific drug action, the side effects, adverse reactions, for example, vomiting, nauseous, things like that, and then client's knowledge and learning and needs about the medication. So you also have to provide that information to the client. And status and appearance of the subcutaneous site, ability of client to cooperate during the injection, previous injection sites used. Now, the equipments are vial or ampule of the correct sterile medication, sterile tuberculin syringe, needle gauging from 25 to 27 inches. So let's see what we have here. 25 to, so we only have 19. We only have 19. And then alcohol swab, dry sterile gauze, medication administration record. You have to have the medication sheets and clean gloves. We don't have clean gloves. So first is to always perform the hand hygiene appropriately. It's for infection control. And you have to prepare the medication from the vial ampule for the drug withdrawn. It's to prevent, again, the medication error. Introduce yourself and verify the client's identity, and also provide privacy to the client. It is to prevent medication error and make the patient feel comfortable during that procedure. And assist the client to a comfortable position. So just ask him which his comfortable or her comfortable position is, if it's this part or this part, to keep the patient at ease. Then explain the purpose of the medication, including the relevant information about the effects of the medication, like let's say the adverse effect or the side effects of the drug. So you have to educate the patient regarding that one, so that whenever they feel something, they will then just instruct them to visit the nearest healthcare center or their physician. Then select a site free of tenderness, swelling, scarring, itching, burning, or localized inflammation, and one that has been frequently used. So it has to be like a clean one, no bruises, no scarring, no lumps, no bumps, no burn or localized inflammation. It's to allow for accurate reading of the test site at the appropriate time. Now you have to put on your clean gloves. It is very important. So gloves help prevent exposure to contaminants. Now, next is clean the site with an antiseptic swab. So you have to start from the inner canthus to the outer canthus in a circular motion. It's to prevent the pathogens from the skin to enter and the tissue by the needle. It also allows the skin to dry and prevents introducing alcohol into the tissue, which can be irritating and uncomfortable. Now place and hold the swab between the third and fourth fingers of the non-dominant hand. Third and fourth finger. For easy retrieval. And then remove the needle cap by pulling so the needle cap, this is the needle cap. Now remove the needle cap by pulling it straight up. Now this decreases the risk of accidental needle stick injury. Now hold the syringe between the thumb and the foredominant hand, and then pinch skin with the non-dominant hand. So you have to pinch the skin like this one. So here. So this is where you put the cotton ball with the alcohol, and you pinch the skin using your non-dominant hand to provide easy entrance of the needle. Now release the skin, then grasp the lower end of the syringe with the non-dominant hand to end the plunger. So do not move the syringe. Then pull back the plunger. So you have to pull back the plunger. You have to aspirate, ascertain that the needle is not in the vein. You have to aspirate to make sure that the needle did not hit the vein. So first you do this, then release, then aspirate, then you have to make sure that there's no blood inside the syringe. Now quickly withdraw the needle by applying the pressure with the antiseptic pad. So withdraw it quickly, and then put the antiseptic pad on the injection site. Now assist the client to a comfortable position to make sure that the patient is comfortable and relaxed. So do not throw the needle together with the syringe. You have to remove the needle from the syringe and dispose the needle to the needle container and the syringe to its designated container to prevent accidental needle stick injury. So don't throw the syringe with the needle in one place. You have to separate them. Now document all relevant information. It's for legal purposes. So next is to administer intramuscular injection. So what is intramuscular injection? So these are injections into a muscle tissues. Medication are absorbed